Client Assessment, Reassessment and Treatment Planning MBLEx Exam Question and Answer. Question 1. A client enters a treatment with a current diagnosis of torticollis. What area of the body will you expect to find this condition? A. Hand. B. Neck. C. Foot. D. Back. The right answer is neck. Explanation: torticollis is an atypical torsion contraction of the neck which distorts the balance and positioning of the head and neck to either one side or the other. Question 2. During an assessment, a massage therapist instructs their client to move a part of their body without assistance. This is known as A. Resistive range of motion. B. Active assisted range of motion. C. Passive range of motion. D. Active range of motion. The right answer is active range of motion. Explanation: when a client performs an unassisted movement of their body, they are displaying an active range of motion. This is used to determine the client and number 8217's natural range of motion. Question 3. Which of the following is not a contraindication for massage? A. Fever. B. Acne. C. Tendonitis. D. Acute arthritis. The right answer is tendonitis. Explanation: tendonitis is an inflammation of the tendon, the tissue that connects muscle to bone. Tendonitis occurs most commonly in the knee, foot, elbow and shoulder, and causes tenderness, pain and restricted movement. Massage is also a common technique used by therapists to treat tendonitis. Question 4. Which of the following is an absolute general contraindication to massage and bodywork? A. Chronic diarrhea. B. Prolonged constipation. C. Asthma. D. Appendicitis. The right answer is appendicitis. Explanation: appendicitis is inflammation of the appendix and is a surgical emergency. Many cases of appendicitis require removal of the inflamed appendix by laparotomy or laparoscopy due to the high mortality associated with rupture of the appendix, which may lead to severe complications such as peritonitis and sepsis. Question 5. Which of the following is not a condition that is relieved by massage? A. Muscle tension. B. Muscle strain. C. Headache. D. CVA. The right answer is CVA. Explanation: cerebrovascular accident, the sudden death of some brain cells due to lack of oxygen when the blood flow to the brain is impaired by blockage or rupture of an artery to the brain. A CVA is also referred to as a stroke. Question 6. How do you know when the client relaxes? A. Deep rhythmic breathing. B. Closed eyes. C. Snoring. D. Sleeping. The right answer is deep rhythmic breathing. Question 7. Exercise during which the patient does not assist the therapist is called? A. Passive. B. Active. C. Resistive. D. Action. The right answer is passive. Question 8. What do you do if you are working on a client and she complains of pain where you are working? A. Stop the massage. B. Say no pain no gain. C. Only work areas that don't cause pain. D. Back off and continue communicating to be sure she is comfortable now. The right answer is back off and continue communicating to be sure she is comfortable now. Question 9. What is the best way for client with mild, low back pain to bend forward from a standing position to avoid further aggravating the condition? A. Extend the knee while bending and straightening. B. Tighten the quadriceps. C. Precede the movement with posterior pelvic tilt. D. Flex the knees while bending and straightening. The right answer is flex the knees while bending and straightening. Question 10. If when palpating a tight muscle you discovered a band of fibrous adhesion, what would be the best technique to relieve the fibrosity? A. Gliding. B. Kneading. C. Friction. D. Percussion. The right answer is friction. Question 11. For a client who had a recent heart attack, what's the best treatment? A. Abdominal and thoracic massage. B. Deep friction to chest. C. Effleurage and petrissage to limbs. D. Effleurage and petrissage to limbs. Effleurage and petrissage to limbs. Effleurage and petrissage to limbs. Quick paste massage. The right answer is effleurage and petrissage to limbs. Question 12. If you notice client has swell on the knee, what technique would you use? A. Effleurage. B. Friction. C. Tapotement. D. Vibration. The right answer is effleurage. Question 13. If a client is HIV positive but showing no symptoms, how do you treat him or her? A. Wear gloves and mask. B. Treat them as usual. C. Ask permission from them to treat. D. Ask permission from doctor. The right answer is treat them as usual. Question 14. Client trips as your front door, falls and break her leg, what sort of insurance covers it? A. Life. B. Health. C. Malpractice. D. Liability. The right answer is liability. Explanation: liability insurance is a part of the general insurance system of risk financing to protect the purchaser, the insured, from the risks of liabilities imposed by lawsuits and similar claims. It protects the insured in the event he or she is sued for claims that come within the coverage of the insurance policy. Question 15. If you have a recent injury that is swollen and hot, how do you classify that? A. Sub-acute. B. Acute. C. Chronic. D. Subchronic. The right answer is acute. Question 16. If you ask a client to turn his head to the side so you can see how much range of emotion he has, this is considered what type of movement? A. Adduction. B. Active resisted. C. Passive. D. Active. The right answer is active. Question 17. Which would be contraindicated when doing range of motion on the lower extremity of a supine client? A. Make sure you don't hyperextend the knee. B. Make sure the hip doesn't rotate as it flexes. C. Make sure proceed the movement with posterior pelvic tilt. D. Make sure the hip doesn't hyperextend. The right answer is make sure you don't hyperextend the knee. Question 18. If a client over the age of 40 has abdominal pain and fever during a session, the massage, bodywork practitioner should A. Recommend antacid and not proceed with the massage. B. Refer the client to a physician and proceed with the massage. C. Refer the client to a physician and not proceed with the massage. D. Recommend antacid and proceed with the massage. The right answer is refer the client to a physician and not proceed with the massage. Question 19. If a client has an emotional release on the table and starts crying, what should you do? A. Ignore it. B. Refer him to a psychologist. C. Ask the client to leave and come back when he is emotionally stable. D. Be supportive and ask if it's okay to continue working. The right answer is be supportive and ask if it's okay to continue working. Question 20. Client comes in complaining of wrist pain from a fall on the way to your office. What would you do? A. Deep pressure. B. Range of motion to inhibit inflammation. C. Refer to physician. D. And B. The right answer is refer to physician. Question 21. Client presents with difficulty in flexing the forearm and abducting the shoulder. Which muscles are involved in the restriction? A. Ancinus and teres major. B. Triceps and pectoralis major. C. Biceps brachii and deltoid. D. And B. The right answer is biceps brachii and deltoid. Question 22. When the client is in prone position, the soleus muscle is underneath the A. Prenus brevis. B. Tighten the quadriceps. C. Flexor hallucis longus. D. Gastrocnemius. The right answer is gastrocnemius. Question 23. Client presents at a triathlon with a high fever, nausea, dry skin, and a red face. These are signs of A. Heat stroke. B. Heat prostration. C. Shock. D. Heat exhaustion. The right answer is heat stroke. Question 24. A woman has fallen and injured her ankle. She says heard something snap. She looks pale and is sweating. What should you do? A. Have her try to walk on the injured ankle. B. Care for the injury as though it were serious, refer to physician. C. Apply heat and elevate the injury. D. Apply a dressing and loosely bandage. The right answer is care for the injury as though it were serious, refer to physician. Question 25. Which of the following practices should be avoided by a massage, bodywork practitioner? A. Keeping nails trimmed. B. Wearing perfume or cologne. C. Wearing a short-sleeved shirt. D. Rinsing with mouthwash prior to session. The right answer is wearing perfume or cologne. Question 26. If a client has epileptic convulsions, the massage, bodywork practitioner should A. Keep the victim sitting up. B. Apply direct pressure to temples. C. Push away nearby objects. D. Force a blunt object between the victim's jaws. The right answer is push away nearby objects. Question 27. How can the massage, bodywork practitioner best access the presence of postural misalignment, soft tissue restriction, and inflammation? A. Observation and palpation. B. Traction and stretching. C. Resistive muscle testing. D. Medical history and interview. The right answer is observation and palpation. Question 28. Which of the following assesses the joint or ligament involvement in pain and the limitation of movement? A. Active ROM. B. Assistive movement. C. Passave ROM. D. Resistive movement. The right answer is assistive movement. Question 29. Which is the most important for a massage, bodywork practitioner to ask first when a client reports of pain during a range of motion assessment? A. Does this movement always produce pain? B. When did the pain start? C. Where is the pain and can you describe it? D. How did it happen? The right answer is does this movement always produce pain? Question 30. When a client and number 8217-S skin is discolored with a bluish tint, this would be an indication of which body system dysfunction? A. Muscular. B. Cardiovascular. C. Nervous. D. Skin. The right answer is cardiovascular. Explanation: the bluish tint in a client and number 8217-S skin is an indication of a cardiovascular issue and is due to a lack of oxygen within the blood, also known as hypoxia. Question 31. A regular client has recently complained of pain in the arches of their feet. Which of the following healthcare providers should you refer your client to? A. Physical therapist. B. Chiropractor. C. Podiatrist. D. Orthopedist. The right answer is podiatrist. Explanation: a podiatrist is a doctor devoted to the study, diagnosis and treatment of disorders that affect the foot, ankle and lower leg. Practitioners of podiatry may focus on varying specialties within the field, including primary care, orthopedics, biomechanics, pediatrics, geriatrics, sports medicine and surgery. Having an understanding of the different branches of medical providers will increase your effectiveness with your clients and allow for a better network of practitioners. Question 32. A client has recently been diagnosed with hyperthyroidism. Which of the following symptoms would you expect to notice about the client? A. Weight gain. B. Fatigue and dullness. C. Nervousness. D. Sensitivity to cold. The right answer is nervousness. Explanation: nervousness, a racing heart, trembling hands and anxiety are all common symptoms of hyperthyroidism. Hyperthyroidism is an overproduction of thyroid hormones which speed up chemical processes and metabolism within the body. The other answers are symptoms of hypothyroidism. Question 33. A client is complaining of tension headaches focused along the temporal region. What should the massage therapist instruct the client to do to help locate and palpate the temporalis muscle? A. Rotate head from side to side. B. Pinch closed and open eyes. C. Client open mouth and relax their jaw. D. Client clench and relax their jaw. The right answer is client clench and relax their jaw. Explanation: the temporalis muscle has one action, and that is to clench the jaw during mastication. The best way to locate and palpate the temporalis muscle is to instruct the client to clench and release their jaw while the therapist feels for the origin and insertion of muscle fibers along the temporal bone. Question 34. What does a visual assessment help determine? A. Muscular and structural symmetry and deviations. B. Painful movement patterns. C. Soft tissue injuries. D. Neurological dysfunctions. The right answer is muscular and structural symmetry and deviations. Explanation: a visual assessment can be a powerful tool in determining a client and number 8217-S muscular and structural symmetry and deviation. The findings of the assessment help the massage therapist create effective treatment plans. Question 35. A PLE and number 8217-S scratch test is used to determine the range of motion of the underscore. A. Wrist. B. Hips. C. Shoulder. D. Neck. The right answer is shoulder. Explanation: the PLE and number 8217-S scratch test requires a client to reach behind their back, one hand from above reaching down and the other hand from behind reaching up to scratch between the shoulder blades. The test is designed to assess the range of motion of both shoulders in each direction. The client then repeats the action with the opposite hand to measure range of motion in the other direction. Question 36. While doing an assessment of hip flexion, requesting your client to flex their hip is an example of underscore range of motion testing. A. Isometric. B. Active. C. passive. D. Eccentric. The right answer is active. Explanation: testing the range of motion while the client is moving under their own power is known as an active range of motion test. Question 37. Which test would you use to assess a nerve compression between the clavicle and first rib? A. Costoclavicular test. B. Adson's test. C. Fallon's test. D. Tinel's sign. The right answer is costoclavicular test. Explanation: costoclavicular test is often used to determine a brachial plexus compression syndrome. The costoclavicular test is also known as the military position test since the client rotates shoulders back and thrusts chest forward much like standing at attention. The practitioner feels for changes in the radial pulse to indicate a compression syndrome. Question 38. A client has been diagnosed with a grade 3 chronic pain disorder. What would you expect to see in the client? A. Low disability, high intensity. B. High disability, highly limiting. C. High disability, moderately limiting. D. Low disability, low intensity. The right answer is high disability and number 8211, moderately limiting. Explanation: a client with a grade 3 disability is considered highly disabled but with moderate limitation of functionality. A good example is an injured construction worker with a crushed vertebrae who is disabled from returning to work, but has moderate limitations in daily functions like walking, sitting and eating. Question 39. Which of the following actions would you initially direct to your client to take in order to test the structure and function of scapulohumeral rhythm? A. Abduction. B. Adduction. C. Internal rotation. D. External rotation. The right answer is abduction. Explanation: scapulohumeral rhythm exposes the function of the glenohumeral joint by testing at which degree the scapula activates during an initial abduction of the arm. At 45 degrees, the scapula should engage until the end range motion of abduction. Question 40. Which massage technique is best to work on keloids? A. Deep tissue massage. B. Trigger point. C. Cross-fiber friction. D. Light effleurage. The right answer is cross-fiber friction. Explanation: keloids are a type of scar tissue with an overgrowth of type 3 collagen fibers, creating firm, often shiny fibrous nodules. Cross-fiber friction is best suited to break up and smooth over keloid tissue. Question 41. Assisting your client with a concentric contraction of an antagonist to trigger the CNS to send a message to relax the agonist is a neural phenomenon called _ A. Action potentials. B. Contralateral flexion. C. Neurofibromatosis. D. Reciprocal inhibition. The right answer is reciprocal inhibition. Explanation: reciprocal inhibition is used to relax a muscle on one side of a joint by contracting the muscle on the other side of the joint. This is used to assist the reduction of a muscular tonicity. Caution should be used to prevent a simultaneous contraction which could result in a cramp or muscle tear. Question 42. What condition would you use the Adson maneuver for? A. Piriformis syndrome. B. Thoracic outlet syndrome. C. Sciatica. D. Psychological disorder. The right answer is thoracic outlet syndrome. Explanation: the Adson maneuver is used to determine a thoracic outlet compression. To conduct the Adson maneuver, a massage therapist places the client's arm into horizontal abduction on the affected side to a 45-degree angle while rotating their head toward the affected side. The massage therapist then instructs the client to extend their head, which tightens the scalene muscles, which should magnify any pre-existing compression of the subclavian artery and brachial plexus. The massage therapist palpates for a decrease in the radial pulse while the client takes deep breaths to exaggerate the compression. Question 43. A client has been diagnosed with PSCAVIS, which means they have underscore A. High arches of the feet. B. Flat feet. C. An infected abscess. D. Extreme cavities. The right answer is high arches of the feet. Explanation: a client with PSCAVIS has a foot deformity characterized by an abnormally high medially longitudinal arch, also known as a high medial arch of the foot. Question 44. Upon administering the passive range of motion test on the neck of your client, you find a mild decrease in rotation to the right. Which muscle would be shortened? A. Right semispinous capitis. B. Left levator scapularis. C. Left trapezius. D. Right levator scapularis. The right answer is left levator scapularis. Explanation: the passive range of motion test assesses the antagonist muscles of the body. We are looking for the muscle that would inhibit rotation to the right. In this case, the left levator scapularis is the shortened muscle. Question 45. SOAP is the acronym for detailing our interaction with a client throughout the treatment. Which of the following choices best describes the function of S? A. Evaluation. B. Summary of findings. C. Client experience. D. Homework. The right answer is client experience. Explanation: the S is for subjective, which is a description of the client, and number 8217 S experience.